Now, all this is a fallout of two important meetings that the Prime Minister took today. Meeting number one was with Chief Ministers of 8 worst hit states in the country. The Chief Minister's faces and those states on your screen right now. Now, these states from Maharashtra, Kerala, Delhi, West Bengal, Rajasthan, Chhattisgarh, Haryana and Gujarat, all of these Chief Ministers were summoned by the Prime Minister. It was a virtual meet, of course. All these states were expected to give out presentations on what is their plan to combat COVID-19. And then there was a conversation regarding how to actually curb and try and put in control on the numbers over there. Let's take that forward with our reporters now. We've got Himanshu bringing us details from the national capital. He's got all the details on what Arvind Kejriwal told the Prime Minister. Harsha Kumari Singh joins us with the latest on what the state of Rajasthan told the Prime Minister. Himanshu, to you first. We're talking about the first meeting that happened, which is with the 8 problem states or the hotspot states, if we can call it that at the moment. What is it that the Chief Minister of Delhi told the Prime Minister?
Well, Delhi Chief Minister actually has said 3 important things to the Prime Minister. One, he has briefed the Prime Minister and admitted that on November 10th, the number of COVID-19 cases had risen to 8,600 at one time. But since then, there is a gradual decline. There is also a decline in the positivity rate in national capital. And he has also said that we are hoping now, considering the measures that are being initiated to contain the pandemic, that numbers will fall further. But importantly, Kejriwal made 2 important points before the Prime Minister. One, he said that one of the reasons why there is a third wave now in the national capital is pollution. And he has mentioned the problem, the challenge of parali burning, and requested the Prime Minister that he needs to intervene to ensure the Delhiites don't suffer from parali every year. And this is one of the reasons why there is a third wave. That's the reason Kejriwal has put before the Prime Minister. And at the same time, Prime Minister has also been requested by the Delhi Chief Minister that there must be arrangements made in the central government hospitals, and reservation of 1,000 ICU beds is necessary to meet all the challenges. The idea is that if the numbers again rise after some days, then Delhi must be ready with an adequate health infrastructure to meet with the rise in the number of patients. And number of ICU beds needs to be increased by 1,000 is one specific suggestion Kejriwal has made.